My name is Chloe Novak, and I will be talking about the regulation and use of dietary supplements in the United States. What are dietary supplements? According to the Food and Drug Administration, dietary supplements include vitamins, minerals, herbs, amino acids, and enzymes that come in pills, powders, and potions. They are available online and in convenience stores, supermarkets, and nutrition shops. And they are promoted as having benefits that may sound too good to be true, including weight loss, enhanced athletic performance, reduced bad cholesterol, and increased libido. Supplements may also claim to address annoying symptoms such as ringing in the ear, anxiety, insomnia, and arthritis. But dietary supplements are not medicines, and the FDA warns that they are not intended to treat, diagnose, and prevent or cure diseases. This may strike up several questions as to, are dietary supplements safe, and do dietary supplements improve the health of a consumer? How are dietary supplements regulated? Under U.S. law, supplements are considered to be safe and are therefore under very little regulation and quality control. Dietary supplements are not required to be approved by the FDA. However, if negative effects or evidence of false claims surfaces, this issue is to be regulated by the FDA. Basically, originally, a product can be put on the market if all the ingredients are approved, but if this product has false claims or is having negative impact on consumers, the FDA can step in. This puts consumers at a higher risk because there is less regulation and less accountability of the manufacturers. Therefore, there is higher risk of contamination of these products due to lesser quality control. There is not a lot of scientific evidence proving that all dietary supplements are beneficial to overall health of the consumer, and it is possible dietary supplements can negatively affect the consumer's health. But this is unknown due to the lack of knowledge and studies performed on these supplements. History of regulation of dietary supplements. The Dietary Supplement Health and Education Act was made in 1994. This said that dietary supplements cannot be regulated as food additives by the FDA, and that there is two categories of dietary supplement ingredients. First, there's grandfathered ingredients that are considered to be safe for continued use by the consumer. All dietary ingredients that were on the market in October of 1994 were grandfathered. New dietary ingredients are new and must be approved by the FDA. Before putting a new dietary ingredient on the market, a provider must notify the FDA and will only be approved if there is a legitimate scientific proof that proves this product to be safe, such as a study or quality control proof of efficacy of if the product is effective. Introducing this new regulatory scheme created a large economic impact on dietary supplement industry, resulting in a mass production of thousands of new products. Dietary supplement use in the United States is actually the largest country of dietary supplement use. Many Americans turn to dietary supplements in hope to improve their health, whether it be sleeping patterns, weight loss, muscle retention, immunity, or a plethora of different incentives. Dietary supplements are viewed as a cheap and efficient way to address health concerns. The market for dietary supplements is growing at a rapid pace, and currently 85,000 plus products are available on the U.S. market, and these numbers are projected to increase significantly. Why is regulation of dietary supplements a concern? As I just said, dietary supplement is a growing market, and consumer demands for these products are also growing. For example, in 1994, when the Dietary Supplement Health and Education Act first became law in the USA, about 600 U.S. manufacturers of supplements were producing an estimated 4,000 products. However, by 2012, more than 29,000 supplement products were on the U.S. market, but few documented analytical methods or reference materials were available for these products. This growth in the market has also been evident internationally. This is of concern because though the demand for these products and the innovation of these products continues, analytical methods that prove these products to be safe and prove that the labels are truthful are not available. Therefore, the labels, there's no proof that these labels are being honest or that these products are doing what they are saying they're supposed to. Between 48 and 73% of adults consume dietary supplements daily, which is most U.S. citizens. In 1994, there were 4,000 dietary supplements on the market, and about 10 years later, the number of products increased by 75,000. Obviously, dietary supplements are growing at such a high rate for the demand for and innovation of, because we want to use dietary supplements to better the health of the consumer. However, because analytical methods are not developing at as much of a fast rate, this is of concern because there is no promise or scientific studies supporting the positive and safe effect of these supplements. Dietary supplements are used by a majority of Americans on a regular basis to improve health. However, there is no proof, and this is of greatest concern. Why is regulation and use of dietary supplements a controversial topic? There is conflicting evidence of positive and negative results to health in response to using dietary supplements, making the use of dietary supplements a very confusing and controversial topic. Ultimately, though dietary supplements have the power to be very beneficial to human health, lack of regulation of dietary supplements can cause harmful effects on a consumer's health. This causes controversy between dietary supplement supporters and non-supporters because technically there is evidence to support both claims. However, if regulation of dietary supplements is improved, this controversy may come to a close because problems with regulation is what is causing negative results of dietary supplement use. This means the argument we are arguing between dietary supplement supporters and non-supporters is that are dietary supplements more helpful or harmful to the health of a consumer? Viewpoint number 1 is pro-dietary supplements. Dietary supplements can be beneficial for a consumer's overall health if used properly. Too much of a good thing can be a bad thing. They should not be used as a treatment plan, and ask a doctor if it can take specific dietary supplements along with current medications. Oftentimes, medications and vitamins can interfere with each other. For example, vitamin K causes blood thinners to be ineffective, which can be very dangerous. Taking a supplement to increase nutrient intake if you do not get them through your typical diet. This is a common way that dietary supplements can improve our health. For example, if you're vegan, you often can take a B12 supplement that you do not intake in your normal diet. However, taking supplements will not take the place of a healthy diet. Therefore, if you are trying to improve your nutritious intake, it takes you putting in good foods into your body, and these supplements do not act as correctors. You must do your part. Taking supplements to help battle chronic disease is another common reason consumers like to take dietary supplements. It is proven that fish oil pills can lower blood pressure, triglycerides can reduce the risk of heart disease, and chamomile can improve sleep. How to yield safe and effective results from dietary supplements. Be sure your supplements contain natural nutrients, not synthetic nutrients. Synthetic nutrients are not absorbed as much by the body and can lead to health deficiency. This can happen because if a consumer is reading the label and can see how much of a nutrient is in the pill, this, if it's a synthetic nutrient, is not all fully being absorbed. Therefore, natural nutrients are preferred because the full amount can be absorbed by the body. Also, don't use excessive amounts of a product because this can lead to toxicity. Like I said before, too much of a good thing can be a bad thing. So follow the dosage on the bottle and be sure to have permission from a physician. For example, too much vitamin K can cause bone loss, and too much calcium can lead to increased risk of prostate cancer in men. Viewpoint number 2 is anti-dietary supplements. Consumers can be negatively affected by dietary supplements more than positively affected due to the lack of regulation, quality control, and lack of scientific proof that each dietary supplement is safe to use. There are 3 things that are the reason that dietary supplements can be dangerous. And these are, dietary supplements in the US are presumed to be safe, but there is little scientific evidence proving this to be true. Due to the lack of regulation, manufacturers may not be maintaining standards of their product, and mechanisms to assess the bioinformatics and efficacy of products are not used, and accurate information of a product is not provided to its consumer. It is very important that when a product is put on the market, that the labels are truthful and that as much information about the product is given to the consumer so that the consumer can make an educated decision with sufficient information to decide if a dietary supplement is a safe decision. How should regulation be improved? Americans want to push for greater regulation, or some Americans want to push for greater regulation of dietary supplements due to their growing demand. They want that they believe that the FDA should have the power to approve or disapprove a new dietary supplement product before they enter the market, not just a new ingredient, as I said before, because sometimes a new dietary supplement may have all grandfathered ingredients, but this doesn't mean that altogether that this is safe and effective. We also think that the FDA should gain the greater power to take unsafe products off the market, and some Americans hope for an increase in overall government regulation in order to ensure that products are not promising false claims. If regulation is not improved, If regulation is improved, manufacturers will be more accountable in improving mechanisms of quality control to provide accurate information of their product to consumers, due to more accountability. How do we know the products are effective? Mechanisms of bioinformatics and studies to test product effectiveness need to improve to provide consumers with sufficient information to make informed health decisions before consuming a dietary supplement product. Concerns about ingredient misidentification, safety concerns, and quality assurance/control problems continue to be important for the industry and the public. Negative health results due to dietary supplements are as follows. New ingredients are not regulated and may have an unknown effect. Specific ingredients or new products. Specific ingredients in many weight loss dietary supplements have caused various negative health outcomes, including increased heart rate and blood pressure, kidney and liver problems, and rectal dysfunction. Dietary supplement products can be dangerous to take with other medications. Taking vitamin C and E can reduce effectiveness of chemotherapies. Unknown effects of ingredients within a dietary supplement can cause trips to the emergency room. This is due to a lack of knowledge manufacturers have of their product, as well as a lack of knowledge consumers have of this product. There are 3 things that shape viewpoints and guidelines around the use of dietary supplements, and these are politics, economics, and socio-cultural factors. We will discuss these concerns regarding the United States, because this is the country where dietary supplements are at the highest demand.